how do we bring AI to scale, use it more places, use it across the enterprise? We needed to think of it not as tools, but as co-workers that are, that workflows and processes are blended between humans doing things and agents doing things. And how are we going to understand when those agents were doing the right things, doing a good job? And ultimately that gets to, can we trust it, right? Because if we don't trust it, we won't use it. Right, we won't integrate it, and then if we have to quote unquote pull it out or give it feedback because there's drift around it, how do we know the drift is there? How do we correct it? And do we have to unplug it? Right, this is a journey we're going on that we're walking towards as we started using AI in more places.
Welcome to the Analyzing Healthcare podcast, brought to you by Scale Community. Scale is a global healthcare-focused member network where healthcare leaders come to connect, learn, share ideas, and shape what's next in our evolving healthcare landscape. To take advantage of all that Scale Community has to offer, from expansive content to virtual and in-person events to interactive peer networking opportunities and more, check out Scale Community at www.scale-community.com. Membership options range from free to paid, so if you enjoyed today's discussion, please take a moment to sign up for your preferred membership level. All right, welcome to the next episode of Scale Community Technology and Innovation in Healthcare podcast. I'm joined today by Tom Andriola. Tom brings a wealth of experience in AI technology across a number of different industries, but extensively within healthcare as well. Tom was the former Vice Chancellor and Chief Digital Officer at UC Irvine, including the UC Irvine Health system. And Tom is currently the Market and Business Development Exec of Public Health, or the public sector and healthcare at Dynatrace, which we'll get into later in this conversation as well. So Tom, welcome to the podcast. It's great to have you here.
Jason, thank you. Wonderful to be here.
So let's maybe kind of break the conversation in two. We can talk a little bit about your experience at UC Irvine and how technology was being adopted within the health system specifically of that organization. And then maybe a little bit more currently, what you're seeing in the market in terms of adoption of AI and some of the considerations related to that and how Dynatrace is helping to facilitate those dynamics in the market, if that makes sense.
Yeah, that'd be great. Jason, maybe I'd start just like kind of how I got to UC Irvine, right? Because the path is kind of an interesting one and plays right into your question. So I've been in healthcare for a couple of decades. You have both been a CIO in the medical device space, is where I cut my teeth. And then I got into health IT and actually ran several of the IT product lines for Philips in an earlier life before I joined the university. When I first joined University of California, I was CIO over the whole system. And one of the big accomplishments there was we built our first UC-wide data platform where we had all of the electronic medical records aggregated across entities like UCSF, UCLA, et cetera, and then medical images in the same way, and then genomics information, right? So we built this quote unquote, let's call it, patient data assets that became very, very valuable. When I came to Irvine, one of the first things that they asked me to do was kind of jump into the big data movement, but to be much more broad around, at the time, we were just calling it precision health. Different than precision medicine because, our vision was around how do we keep people healthy, not just address people with acute diseases or chronic diseases, but also how do we return people to health and keep them healthy and include things like what was going on in the consumable wearable movement at the time. So we built out a platform, and of course, when you build out data platforms, you think a lot about the technology that's generating the data that you then kind of want to pipe into your data platform environment. What we didn't see at the time when I joined Irvine was the AI movement that was going to come on top of that, right? That kind of hit us by surprise with the ChatGPT moment. The other thing that I would say about when I came to Irvine was it was very much about kind of building that assets and taking the enterprise that we were and really putting a data movement underneath it to drive our decision making and our excellence. But in the time that I've been here, there have been some other pivots. For example, we have opened several new facilities organically, clinics, and now a new hospital. And we've done acquisitions that have more than doubled the size of the health enterprise, right?
So what were some of the most exciting initiatives that you had under your umbrella as a chief digital officer for the UCI Health system?
Yeah, so I think one of the first things that that we did when I came to Irvine was really focus on a data platform. But my especially what my experience has been, I've cut my teeth on the healthcare big data movement for over a decade now. We really wanted to be a kind of out in front on understanding health data, how to drive precision health decisions, right? More and more personalization, deeper understanding, bringing together data generated in the healthcare setting and what was going on in the consumer health movement. And so we built out a data platform, which ultimately became a platform under something we call the Institute of Precision Health. And so that was a lot of fun. Worked with some great partners in industry to kind of help us build those capabilities. This was really before the pandemic started. So the technologies were pretty nascent to do these types of things back then. They've matured a lot over the last 5 years. And then the pandemic, with all the things that it brought on us, it actually gave us a great example of how to use the data as a way to drive through you know, a situation where we were all kind of struggling to how to get through. We were benchmarked. One of the hallmarks to show that like our strategy actually delivered great outcomes is UCI was benchmarked during the pandemic of having the third best patient outcomes for inpatient experiences of COVID patients, right? Which, for a facility that like UC Irvine, we were very proud of, not only do we kind of manage, the volumes and all that, but we were great having great patient outcomes. We were at the forefront of helping the administration at that time because of the data platform investments that we had made and the capabilities around analytics. We were part of a small number of institutions that were advising the White House task force on expanding the use of monoclonal antibody therapies in outpatient settings so we could save beds for the really, really sick patients. And again, why were we able to kind of provide that type of kind of feedback and expand the protocol? Well, it's because we were driving we were making data driven decisions about how we were making the decisions in our facilities, and we were able to take those learnings and share them with others, actually test them and combine that our learnings with what other health systems like the Mayo Clinic and hospitals in Texas were also saying. And we went to Washington and said, monoclonal antibodies, you should really expand this protocol because it's so narrow right now. Too few patients are able to qualify for it, but our data shows you could expand it without creating any more risk. And now many more patients would qualify for it to get it in an outpatient setting. And it keeps those beds free for the patients we really have to put in them. At the time, as if you remember, this was a really, really critical issue, right? It was all about who's got beds that we could put patients in. And what we were saying is we can use data to help us make decisions on how do we make sure that, right care, right patient, right care, right place, which was critical at the time when we were dealing with this in 2020 and into 2021.
What are some other ways that the Institute of Precision Health has used data in its delivery of care or in its advancement of care from a clinical research perspective outside of the pandemic environment?
Yeah, I think it's a lot of it today, and I think this is going to continue to evolve. Is a lot of it has been around rare disease, right? And how do we include the combination of electronic health records, everything the health record collects, the genomics information, the medical imaging, and really kind of understand, how we understand rare disease and provide those pathways for disease. Let's call that precision medicine. I think the evolution in terms of where we're thinking of going is there is so much data. There's two things that have really opened up, right? Which is pre-GPT. A lot of us built our data analytic strategies around the structured data that we had. We now can open up to what I call the other 95% of data in the traditional health enterprise, which is the unstructured data that we're capturing in the EMRs and around the EMRs. That now has opened up a whole new realm of how we can think about understanding patient journeys and directing them in the best way. The second is, and this is something we were on in 2020, which is the consumer health movement and the data from those devices are just getting more and more quality, clinical quality grade all the time. And this is what we've seen. And so you have to think of that as part of your data ecosystem and figure out how you combine continuous data that is going to, that is much more like telemetry in with what you capture in your more episodic healthcare settings. And how do you put that data together and start to really drive health journeys in a way that are not only how you're treating patients, but also the engagement and personalization that you can do. And you think now the kind of things we're doing through our phones and talking to conversational agents that are helping direct us. I show people how I'm doing this now. And this is now kind of the way that healthcare now extends right to the fingertips, right? And that people can keep it front of mind when they want it and not wait to when they can get the next appointment within the health system.
So it sounds like a more data-driven approach to measuring performance, outcomes, correlations between inputs and outputs, as you try different avenues of care with different types of patients. And so that's a technology adaptation, but it's also a cultural shift for a healthcare organization to move to that type of environment. Can you talk a bit about how outside of technology, what was required to change from a management perspective, from a cultural perspective, to take advantage of these technology capabilities, and how was that received? Was it resistance? Was it welcomed? What did that look and feel like on the way through?
Yeah. Oh, I think we all have our experiences on this, right? There's always going to be a set of resistance. And in healthcare, that resistance is around, ensuring that we do no harm, right? So there's always going to be, if there's a new potential way and that technology is enabling, people are going to want to see the evidence, they're going to want to experience it. And some of that is just, it's about getting them to the table, engaging them in the process, and also giving them their own experiences. I actually have been fascinated to watch the way that ambient listening has just gained so much positive momentum, right? We think about all the different ways technologies come into healthcare. It always has felt like we're pushing the boulder up the mountainside to try to get usage, to try to get benefit, to try to get buy-in. And then ambient listening comes along, and it was just the right type of technology designed around the way doctors work. And when they saw the value, they started pulling for it in a way that I don't know that I had ever seen in my healthcare, career, right? Why? Well, it just solved so many pain points for so many people within, the healthcare ecosystem. For the doctor and the medical professional, it allowed them to focus on the patient rather than sitting at the computer making sure they document things, which is one, why they got into medicine in the first place. It saved the doctors from spending all their times in the evenings doing clinical notes, clinical documentation, instead having time to sit down with their family and their children and enjoy a work-life balance. And I've even seen emails from some doctors that say, thank you. You've given me my life back, from this technology. From a patient perspective, the benefits to them is they feel like they're being heard and listened to and paid attention to, rather than feeling like the doctor is more concerned about getting into the computer what they're saying than actually focusing their attention on what they're saying, what's coming out of my mouth. And then, the other thing that we found is when we started using AI to generate the patient summaries, and we told the patient summaries to be written in a non-clinical language, something that the average person could understand in an empathetic tone. Patients gave us the feedback that they liked those summaries better, right? They were obviously seen by the doctor before they, and human in the loop click before it went to the patient, but the patient said, we can understand these summaries. So all of a sudden, when everyone got value out of the equation, all of a sudden it became less of a push and more of a pull. And I think that's been super interesting.
So on something like scribing, note taking, sounds like it's, the key question, does the technology increase burden or reduce burdens? Unequivocally reduces burden, right? Well, there's a big debate, EMRs, increase burden, decrease burden, and much, much grayer. A lot of providers are not happy to have to enter all the fields in the systems, so to speak. But if you take that to the next place on kind of evolution, maybe something a little more controversial, clinical decision making, and you apply technology to do more than just note taking, I imagine your answer might change. You might face more resistance. So, can you talk about where you see the bounds of technology within the clinical ecosystem? Is it purely for things that reduce burden and are non-controversial, like note taking, or do you see technology encroaching or being utilized, maybe said more neutrally or favorably, on a broader portion of the clinical delivery system, including clinical decision making?
Yeah, no, I absolutely, I think you're already seeing it happening in terms of, that augmentation. I mean, you think about plugins to the EHR like UpToDate. We used to joke, when we used to get together as UC Health CIOs and saying, you want to get fired? Take UpToDate away from the docs. And that'll probably cost you your job. It's because it was such an integrated way in terms of they wanted to have that at their fingertips to be able to utilize it as a resource when it was there. And so if you think of that, that's a technology, right? It's a plug-in resource that is now enabled for them, that helps them in their understanding, checking, and decision making. And so really, I think what we're going to see is like, the evolutions around those types of things. It's going to be more data at my fingertips. It's going to be the surgeon who did their pre-work but is now in the room and might have within their glasses the ability to just do a very quick tap or with a voice instruction open up something at the side that goes back to the that paper that they looked at as part, but they couldn't remember exactly the way the orientation of the image was. So they could bring it up right here and not actually even have to leave the station that they're at with the patient, but just glance over here and like, okay, so that was the angle I'm supposed to come in at, right? And so yeah, I think what we're going to see is more integration of the things that doctors and medical professionals use that are going to be more at their fingertips. They're going to be more voice driven because now that we have so much of it captured in a digital format, we can now bring it to where it's needed, when it's needed, and in a format when it's needed. And I think that's the key. It's like the right information at the right time delivered in the right way becomes valuable. And then all of a sudden doctors say, I want that. And again, will it take over the decision? No. Will it be, but I think we will see kind of alongside, I think we'll see first pass. I mean, we already see some of that in kind of radiology, which has always been on the leading edge of like first read, second read. And I just think we'll see more of that. And then as we get more comfortable, I think what we'll see is we'll see some more of that pushed out to be interactions with the patient to reduce the number of touch points that patients need to have with the healthcare system where they can have it in the right context beforehand. Like I shouldn't have to call the doctor to ask about trazodone versus an over the counter to help me sleep. I should be able to engage with a conversational bot that has that information, that could be my first touch point. And then if I decide I want to go prescription for trazodone, then I contact the health system to get the prescription.
So it sounds like first phase, maybe, non-controversial areas like note-taking, auto note-taking, summaries of encounters and patient summaries. The next phase is about informing. So bringing the right information at the right point in time to allow the human to make the decisions with the right recall of information. Let's talk about governance in that second phase, because over time you can imagine that then there's this question of which is you talk about sort of in the pandemic tracking these big populations and seeing outcomes and being able to make assessments of where to invest resources and how to make decisions based on the macro picture. Any one provider is always going to be at the micro level in a given situation. So do we encounter a situation where a provider will be asked, well, why did you deviate from what was recommended to you? So we go beyond just informing with information and educating to then having that AI technology be the standard and having to justify deviating from the standard.
Yeah, so I think there's a couple levels of this. So one is governance around what kind of tools we're okay bringing into our environment and how we might use them. And so most organizations have set up, for example, they've always had some type of technology governance. Now it's very popular to talk about, what does your AI governance model look like? Because again, these tools are providing, there's a lot of these tools developing, a lot of new companies that are kind of bringing them forward, and you have to have a way of kind of vetting them and then a process for how you bring them into the environment. But I want to talk about another part of governance you talked about, and I think this is, sometimes people refer to this as AI assurance frameworks, right? Or I call it accountability frameworks. So one of the things that I get out and talk about, not just about healthcare, but even more generally is, we're not going to start to use these tools in decision making or allow them to make decisions on our behalf until we have a very high level of trust in them. And the question is how do we know we can trust them? Right? What is, if I work for you and I make bad decisions, you give me critical feedback. If I continue to make bad decisions, you give me a poor performance appraisal. If I continue to not, take that feedback and correct my behavior, you fire me. What does that look like if we start talking about having an AI agent, an AI coworker that works in a similar capacity? And we need, and this is part of governance, is we need that type of system, accountability system that we need to build. And the reality is, if it's going to be AI, it's going to be technology driven. The accountability system is also going to be technology designed and kind of underneath that. And that was, part of the reason I saw this coming as we were starting to look at how do we bring AI to scale, use it more places, use it across the enterprise. We needed to think of it not as tools, but as co-workers that are, that workflows and processes are blended between humans doing things and agents doing things. And how are we going to understand when those agents were doing the right things, doing a good job, and providing us the feedback so that we could see it not just as responsible, but to the example you use, could we defend around the decisions that it made? And ultimately that gets to, can we trust it, right? Because if we don't trust it, we won't use it, right? We won't integrate it. And then if we have to quote unquote pull it out or give it feedback because there's drift around it, how do we know the drift is there? How do we correct it? And do we have to unplug it? Right? These are all kind of this is a journey we're going on that we're walking towards. And I could see as we started using AI in more places.
Did you get to build any of that out at UCI Health, or was that sort of forward
That's
looking?
it. I think it's overlooking, kind of down. It's like we're walking towards it, and some industries are a little further down that path that are starting to use it. You're seeing some of the missteps when you see kind of a lawsuit pop up. I won't call it any particular company, but you see a lawsuit pop up with respect that they're using out AI or algorithms around decision making, and people are calling them to task about, let's say, customers being wrong, right, or biases being introduced. So the question is that going to stop the journey, or are we going to come up with solutions that allow us to quote unquote understand when that's happening, take corrective actions, defend us if a lawsuit gets pulled up? And that I saw that was going to be a huge part of going forward. And unless we build those types of frameworks into our enterprises, we're just not going to get the full advantage of what these new tools and technologies are going to provide us.
And that's quite an undertaking when you think about it, though, right? So it's enough to go through the systems integration. You mentioned, I think, UCI Health, that tenant integration will take 3 years. So you have to go through 3 years of lift of systems integration, a data layer, standardization across your network, cultural change to decide which problem statement you want to address with AI, which technology you want to use to address that problem statement. Then you have to run a pilot. Then you have to broadly deploy it. And then on top of all that, you've got to implement this kind of governance structure, which is ongoing, that lives and breathes in your organization. And all that sounds feasible to me, but it's a lot. And so then you have to ask the question, is it feasible for all these health systems, provider groups to build that out for themselves? So is that the expectation? Everyone's going to have to build this AI quality assurance program, AI compliance program internally, or are there other types of third-party software that will solve for this problem for us? Governance software. Practically speaking, how is that going to be solved for, and how likely is it that when you look across the country, all these different individual health systems will solve for that complicated challenge?
Yeah, no, so I guess I would answer it this way. It is complicated, but the capabilities that you need are things that actually you're already using. And so part of what we need to, and again, this isn't part of my new role, is talking about you're already using the technology you need to kind of manage and understand this on things like your infrastructure, your applications, your cloud environments. What you haven't thought of yet, because it's early in the game, it's early in the AI journey, is using those same tools and put them on your LLMs and put them on your AI agents to give you the type of, I'll use the word telemetry feedback. The space is called observability. It's not monitoring, it's observability, because it doesn't just give you a bunch of data. It actually tells you about performance, tells you about cost, tells you about, whether it's staying within design mission. And you can do that with everything you're deploying for AI right now with technologies you already have invested into. So it's not going to be new investment as much as it is extending the investment that you need from something that's in the past have seemed like an infrastructure play or application performance oriented. Well, that capability now is going to be enterprise wide need. And one of the places you're going to use it is as you deploy more and more AI as part of, your workflows and as a complement to your workforce. It's like I said, we're really kind of skating ahead of the puck here, but this train is moving so fast around AI. What we're seeing is that we still have some parts of our economy and some parts of our health system that are just still dipping their toe, trying to say we've got some early experiments, and we got others that are asking the question, how do I bring this to scale? To get to the benefits of productivity gains, to really understand how we scale our workforce and our services, we've got to take advantage of these, but we got to do it in the way that we can trust what we're doing, that it's not going to compromise the trust that we build with our patients or with our docs or with our nurses.
So for a provider organization, a health system looking to advance on the maturity curve from wherever their starting point is, what advice would you have to get started? Because do you advise you build out this kind of governance piece to start right from day one, or does that come later? How do you experiment and climb the maturity curve without being reckless?
Yeah, I think as I've looked at a lot of different organizations, in healthcare, and had a chance to look in education, had to also, in some of the CIO forums, you've talked to other industries. The journey is actually, it looks pretty consistent to me, right? It starts with, use of these new AI tools for productivity hacking, make myself a little bit more productive. Like I tell people, like, look, I've hacked 6 to 8 hours a week out with the use of these tools. And I encourage people to try to do it and then tell their colleagues about it so that everyone they work with can find how those hacks can work for them. Because we have too much we have too much closet use going out because people somehow feel like it's cheating. They're going to be negatively reflected on. I think we're starting to get past that with some parts of our society, but I still hear a lot of people talk about, I'm using it, but I'm not telling anybody. That moves to, once you get the productivity gains, people start talking about can we redesign workflows? So let's call that the current iteration of business transformation. How can we really think about these workflows? Now you're starting to talk about the work, where these tools can plug in and how they can quote and take over certain tasks within a workflow. How do you think about human in the loop and those types of things? But you're looking at maybe individual departments, or maybe something that might touch a couple of departments. But when you start to take that we're doing that at 50 places across the enterprise. And this is again where a lot of people consider those first two categories experimentation. And so a lot of people say we're in experimentation mode, and then they get to the point where, like, the term that I've heard people use is we're in experimentation purgatory, which means we're trying to go from a lot of experiments where we have success, we have failure, we have learnings, but now we want to take it to the next level, which is we want to make it an enterprise deployable capability. And that's kind of the journey that I think the leading companies that have leaned in early, who have traveled the first couple of stages of the journey, are now saying to themselves, how do I get here? Right. And it's about not just using these tools, but putting frameworks around them so that they're used in ways that we understand, that we can manage, that we can hold responsibility to, and that we can defend when people want to question how we're using these things.
When you look across your peers, the national healthcare landscape, are there healthcare organizations that you think are leading the charge in terms of adopting these types of AI technology solutions, different health systems, different provider groups? Does anyone stand out?
I hate to call anybody out. I think there are, and I don't know that I want to name anyone specifically, but I think there
Or
are.
maybe a
But
use case that you think is particularly compelling that
well,
you've seen?
I think the use cases right now are, within like individual departments, where they're doing. I think when people start talking about workflows and processes, right, attacking revenue cycle management, right. I mean, these are places, again, back to the administrative side, are going to be a little bit easier, but we're still going to really understand how are these tools being used. Where's the human in the loop? It gets more complicated for clinical. But like, let me share an example. A colleague of mine who started a company on discharge, right? And basically, did time motion studies on discharge that basically had, it was roughly 115 unique steps that have to do with a discharge of a patient out of a bed into a vehicle and over to a skilled nursing facility. 15 quote unquote tasks, and roughly about 54 minutes on average to make it happen. They started to use these tools, and they demonstrated that they could, through use of AI, screen scraping, computer vision, smart use of integration, they could get it down to humans only needing to perform 17 of those steps, and they could bring it down to 14 minutes. Right. And so that was designed as a platform solution, first use case of a platform solution that had a bunch of different AI tools within it that you could essentially say, take something that was very, very manual, lots of different applications, cut, paste, open here, see that field, retype it over here, print out this document, get a signature, lots of just different handoffs that created complexity and lost time, basically through AI against, and saying, how could we create a better mousetrap through the use of these tools and take something, reduce the complexity, create better accuracy, and reduce the time, right? Which is great for the patient. It also opens up that bed a lot quicker, right? So there's a great example of something, a very, very complex process that it took a startup company, the ability to kind of look across that and say, we can solve this problem. And now if we can do this for this particular complex process in a health system, where could we take this platform and start doing similar things with the same tool set?
There's been a lot of talk recently about Epic incorporating their scribing capabilities into their EMR. When you think about 5 years from now, do a lot of these AI functionalities simply get incorporated into the EMR and they become base functionality, or do you still see a rich ecosystem of third-party technology providers that will be servicing the healthcare market?
Yeah, that's a really interesting question that I think a lot of venture capitalists are playing in this space right now, right? Because and I'll move it away from EMRs to enterprise systems. It's like there's a lot of money going into basically disruption of enterprise systems, whether it be the SAPs and Oracles of the world, the Salesforces of the world, that feel like these AI agents will allow a unique opportunity to create workflow orchestrations that sit on top of these things that could disrupt the stranglehold that a lot of those enterprise vendors have had in terms of holding their customer organizations hostage. And then of course within the enterprise play you've got companies like Epic that have like even a stronger kind of hold on the way that they kind of keep their customers kind of really waiting for Epic to create the capability for. I don't know how it's going to play out. I mean, what I think we know from Epic is that they're going to see things that they think are critical to delivering great patient care for their for their customers, and they're going to ultimately get it into the platform natively rather than always needing to plug in third. But what we've seen in not just healthcare but every industry is that innovation layer just kind of moves, right? I mean, there's always the next level of innovation layer that people seem to find is not in the base product and that they need to create. Epic's done a great job in the last decade of supporting that innovation ecosystem in a better way than they did in their earlier career. But I think they'll incorporate the things that they think their core customers want, but I think they'll continue to be innovation, right? So I think the ball will just move. I don't think it'll ever really change.
So when you think about the leadership and org structures at these health systems, where do you think technology will start to pop up in ways that we might not otherwise think? So for example, the quality assurance meeting, I could imagine from this conversation, deserves a engineer at the meeting who's focused on AI, because it sounds like quality assurance and technology will go hand in hand. Where else do you see technology representatives popping up across the organization that we might not otherwise think?
Yeah. Well, I think CIOs today, great CIOs that I've had a chance to get to know and work with, they understand that they can horizontally see across everything an enterprise does in a way that can make them an incredible advisor, advocate, one of the most influential voices in the room because their vantage point allows them to see everything the organization does in a way that only the CEO or top executive does. The nature of technology today underpinning everything that an enterprise does, and that data driven decision making is so critical. Now AI is the driver of both productivity and innovation. CIOs really have the opportunity to be in the catbird seat and be right alongside their chief executive if they one want that role, two they understand how to play that game. I think within that, right, then as you go kind of down, I think your architects and your chief technology officers are going to operate and be very influential into operations. I think when you look at today's enterprise, every enterprise is now a digital enterprise. Almost nothing is done without the use of technology in some way, shape, or form. So the question is what's the difference between a COO role and a CIO role in today's enterprise? If the CIO is creating the application layer and the data layer to be able to operate and drive decision making, what are the difference between those two roles? That's probably a controversial topic to get into, but I would ask a question: do you need two roles there? Is there a difference between needing someone to run the physical plant and the digital plant in today's world, or is it all just one hybrid where you're always looking to try to figure out how to make it more digital, right? Extend where digital can apply.
Just go back to the prior question about what gets subsumed by the EMRs, and I can't speak to Epic as much. I mean, most of the work that we do is in the non-hospital corporate MSO world where Epic is less prevalent, I would say. But my experience has been that the EMRs that have moved into the services space have oftentimes struggled with the services component. So base technology, fine. Add on RCM services, they struggle. And I think that has to do with it's a different delivery, it's a different type of customer service, it's a different need and challenge to integrate into the ongoing operations of a business versus providing, a technology platform. And my experience with the AI solutions is that they aren't quite pure technology. They're not, they have a services component to them. The last mile customization to your organization, the ongoing tweaking, the collaboration with the operations and the alignment with the operations. And so while it is ultimately technology, a lot of it feels like a service, given maybe it's just the state of maturity that we're at today, but they haven't fully productized. And so I do wonder whether these EMR vendors that have struggled to, at least in my experience, provide high quality ongoing services will be the right partner to be your ongoing technology AI services provider. I don't know if I'm phrasing that properly or if it makes sense, but I'm just curious your thoughts.
Yeah, I don't know how it's going to play out either. I think it'll be hard for the EMR vendors to keep up with the pace of innovation and certainly of need. Again, innovation at the end of the day serves need or want. And so I think when you look at how it's been amazing for someone who cut their teeth professionally in the internet era to think back to like how crazy and wonderful those times were, and then they pale in terms of velocity of change and opportunity and evolution of how these tools are developing in terms of what we're going through right now. I mean, that was one of the drivers for me to jump out of the practitioner's chair and jump back into the product tech world. It's just too darn exciting to feel like I was sitting on the sideline to be in the middle of what was going on. But back to your question, I think I think it's going to be hard for the EHR vendors to keep pace, and so I think we'll see a lot of innovation. But of course, the CIO role has this incredible challenge, as well as their business partners around the enterprise like we're paying for a lot of this stuff in the EHR platform. Now we're talking about this additional cost. Does the value we get from additional piece justify paying more money than what we're already paying in the big lump of cash that we give to our EMR vendor? And I think that'll be some of the trade-off. And if the answer is yes, then how do we get them to, from the standpoint of the process, the workflow, how do we get it to integrate? Right. And again, I think more and more as AI is part of that, how the workflow works, the more valuable it will become, because I'm not going to go to a screen to complete the process. I'm going to have a conversation,
Yeah.
right? Or contextually, it's going to understand what the next 3 steps should be now that I completed the task, the step that the human had to do.
Yeah, it's a great point about the incremental investment on top of the EMR. And we didn't really talk about ROI, but it's another reason why focusing on the non-clinical services first, I think, makes a lot of intuitive sense, because you're going to invest incremental dollars to get efficiencies, which involves cost savings. On the patient care side, when I hear the examples that you mentioned, some of it could potentially be reduction in overall cost of care for various reasons, efficiency gains, reduced adverse events, reduced admissions, things of that nature. But a lot of it sounds like improved clinical care, which might not have as direct or clear of a tangible ROI, and yet it's still going to have this incremental investment on top of the EMR to implement. So I think that's
And you think about all the things, right? I mean, our healthcare needs are growing up as we have an aging population, right? As we have a sicker population, that has emerged within, let's just say, the United States. But think about all the things today that we can have happen at home, or that have gotten extended to us in some way that we don't have to physically go to a facility to experience or to have happen. I think we're only going to see more of that. And of course, if that's part of the quote unquote concept of how you define service, AI is going to be wrapped into that now, right? It could be at the analytical level where it's not just, do the test, but the analysis of the test might happen there. The feedback might happen there, right? The Bluetooth connection, if you have Wi-Fi, it might go back and, you might get an immediate quote unquote, report. I mean, I just think we're going to see the boundaries continue to blur in terms of where the delivery of healthcare happens. If for no other reason, it's the only way we can scale to the need that we have in an aging, growing population.
Yeah. Look, your comment on CIO and COO potentially being one and the same, I think is a super interesting concept. And we could spend an hour talking about that, but it also speaks to the rate of change and the amount of change that will be required. And I think that gets to your point about whether EMR vendors will be able to keep up with that. In the few minutes we have remaining, maybe just a quick overview of Dynatrace and what you're focused on at Dynatrace within healthcare, and how if at all, some of the things that we talked about on this discussion relate to what Dynatrace is offering?
Yeah, we talked about the reason I jumped in the conversation, right? So one was it's an exciting time to be back in the product tech world in terms of the rate of change that we're bringing. Two was as I was, at UCI, my role was to try to make us a leader in tech rather than a laggard in tech, which is kind of where we were when I got there. And so, yeah, as I was trying to help us be on the early adopter side of technology, and I saw we leaned in on topics AI heavy, hard, and early. And so we were getting down this journey of productivity gains to kind of, chatbots to simple agents. And I started to see there's no way as CIO that I can bring AI to enterprise scale without an AI assurance framework, or I like to call it a trust and accountability framework underneath the things we were trying to deploy. So I started looking for a platform that could do that. And that's where I found Dynatrace. And as we talked to them, I was like, every organization is going to need this. You are skating ahead of the puck in something that every organization is going to need to have if they're going to benefit from AI, and their boards and they're, are going to demand that of them, right? Because every board is asking their chief executive, so what's your AI strategy? How are you utilizing it? How are we going to win? How are you going to better serve customers? How are you going to secure the next customer? They're asking those questions. And so CIOs are going to be, on the razor's edge of figuring out how to deliver that for their organizations. And so it was kind of seeing where the world was going that I wanted to kind of jump in on something that was not hot exactly right now, but one that was a little bit ahead of the curve, because I think this topic of observability, AI observability, business observability through the lens of how we're using AI is going to be maybe the topic of 2026, right? 2025 is about the year of AI agents. 2026 will be about we've got agents out there. How do we hold them accountable to take over the work that we used to have the human do?
Well said. Tom, I want to thank you so much for the time, for sharing your insights on the healthcare market, where we are now and where we're going vis-a-vis some of these AI solutions. Very, very insightful conversation. So thank you.
Jason, thanks for having me.